Hello and welcome. My name is Aurélie Salver and I'm delighted to be with you today, facilitating this challenge lab on violence against women during the COVID-19 pandemic. We will have half an hour to discuss with our panelists and also with our virtual audience about this topic. I would like to welcome all of you and ask you to please participate and share your valuable ideas and comments to this interactive dialogue through our different platforms on Twitter and Instagram at UfM Secretariat, on Twitter at CHAM, and Facebook UfM Secretariat. And use our hashtag Women for Mediterranean. So the Challenge Lab is an open space to share your project ideas or good practices to support women during the COVID-19 pandemic. Across the UfM member states, lockdown measures were implemented to prevent the spread of COVID-19, yet these health measures trapped many women and girls at home with their abusers. Several countries have seen a rise in domestic violence reports. In France, reports of domestic violence increased by 30%. In Tunisia, calls to a helpline in the first days of confinement rose fivefold. And in Cyprus, helplines registered an increase in calls of 30%. So the number of reports of domestic violence complaints is increasing, while services to assist these women are being compromised. Life-saving care and psychological support to women who experience violence may be disrupted when health service providers are overburdened and preoccupied with handling COVID-19 cases. Even where basic essential services are maintained, there is a greater difficulty in providing a coordinated response between the different health, police, judicial, and social service sectors. These limitations also fuel impunity for the perpetrators. In other cases where movement is restricted or where access to quality essential services is limited or being administered differently as a result of social distancing, requests for help have been decreasing. Countries such as Italy saw a decrease in gender-based violence reports during the first 2 weeks of the lockdown, which suggests that some women may face more barriers to reporting violence or seek help. The COVID-19 outbreak also limits the ability of many women to seek help from networks and organizations that provide support and recognize abuse. It also reflects the digital divide affecting women and girls who do not yet have a cell phone or computer or internet to access services, or who cannot safely use them in their homes with the perpetrator or other family members nearby. So now the confinement is being eased in some countries, and now we are experiencing this second wave. How can we ensure access to support services for women who are victims of violence during the COVID-19 crisis? So to reflect and to talk about interesting initiatives on that topic, allow me now to introduce our first two panelists. First, I will introduce Åsa. Åsa Nielen is a technical officer, gender and human rights at WHO Regional Office for Europe in Copenhagen. Welcome, Åsa. And we also have Meggy. Meggy Lubani is technical project analyst with UN Women's Regional Program on Ending Violence Against Women based in Albania. So welcome to both of you. I would love to know if you have any first comments about the numbers and the stats that I mentioned in the introduction. Åsa, do you want to react on that?
Yes, I can start. Thank you very much for inviting me and WHO to this session and to this conference. We're very happy to be here, as violence against women is something we have worked on for many years, and then in particular strengthening the health systems towards better responding to violence against women. But we also work on data collection, and we are in with UN Women, we are the UN agencies that are responsible for also monitoring violence against women as an SDG goal. So around what you said about the reports, well, we know from experience that this is an issue that is very much underreported. So we don't have the real data. We estimate that this is a much bigger issue, of course, than what we have in the reports. In fact, WHO estimates say that 1 in 3 women will be exposed to violence during their lifetime, which is from a public health perspective, a very high number. I mean, we are now in a pandemic, and usually we say that if these numbers were around a disease, we would be witnessing a pandemic. So, of course, we also know that during crises, during outbreaks, we see increased levels of violence, and this is what I suppose is reflected in this reports that we see. Some might be these increased levels of violence. Some might be the fact that the support systems that usually are there around these women have now been limited because of the lockdown measures and so on, as you say. So that would be my first comment to this, that numbers are generally underreported, but these situations has brought an increased attention to this issue, which is, of course, a positive thing. Over.
Thank you. Thank you, Åsa. Maggie, do you want to add a few things to introduce this Challenge Lab? Yes. What is your perception?
Thank you so much, first of all, for inviting me, and seeing as UN Women's work in ending violence against women is one of our core priorities, and also something very close to my heart personally. I don't want to say the same things as Åsa, because I fully agree with everything she said in terms of reporting and how the pandemic really highlighted the real pandemic that goes on with women during this time. But I just want to look at the other side, that this year, despite the challenges, at least brought something positive. We really saw the power of communities, because they really innovated, and they showed that during hard times, we really can overcome challenges if we come together. And we saw this in many different societies, in many different forms. That's why I'm really excited to discuss the challenges in more detail and see, now that we are ready, we know what this pandemic is, and once we are going through the second wave, we really can address the problems, because we saw during the first wave what worked, what didn't work, and what we can do more and be more prepared. So I'm really excited to talk about the challenges.
Absolutely, Maggie. Thank you so much. And actually, that's a perfect introduction to the first categories of solutions that we've seen in this crisis, which is, as you said, completely linked to the community. So the community is one of the most powerful tools, right, of the anti-violence movement. For while communities can shame, victim blame, or prescribe harmful gender roles in some cases, they can also empower women, collaborate on prevention and intervention, and collectively shape new norms of gender democracy. COVID-19 pandemic has shown us some initiatives that have mobilized community members to protect women victims of violence. We have selected different initiatives, and we would like you to explain why you think they're important, what impact do they have, and to what extent they can be replicated in the Mediterranean and MENA region as a whole. So in Spain, there is the initiative called Mascarilla 19, so Mask 19, or Mascherina 1520 in Italy, which is that you can walk in any pharmacy and ask for a Mascarilla 19, and the employers understand the code, let's say, and call the emergency number 112, and the safety protocol is activated. So that has been one measure. In the UK, the initiative is called Says No More, and safe spaces for gender violence victims have been made available throughout the UK and Northern Ireland. The organization has partnered with the pharmacy Boots to facilitate their pharmacy consultancy rooms as a safe space for victims of domestic abuse during COVID-19. So it gives a chance to women who are confined with their abuser to report the situation and ask for help without having to make a call, right? Which they might be scared to do at home. So you have an already existing network of pharmacies, for example. But the campaign has some challenges. First, the pharmacists need to be trained, which is time and resource consuming, and the word needs to spread about this initiative. So we've seen some famous Spanish artists who have posted video online to advertise the campaign, and it has more than 1 million views on Instagram, and it's already, something strong. In China, we see the hashtag anti-domestic violence during epidemic, and you have individual reports that surface on social media. Some women have created posters reminding people to counteract domestic violence when they see it and to not be passive bystanders. And we can see that this hashtag has been discussed more than 3,000 times on the Chinese social media platform Sina Weibo. So these are some examples of community. I don't know if you've heard about other examples leveraging community that would be extremely interesting to know of. Maggie, do you want to start?
Yes, if I may first say, what I think the advantage of this initiative is compared to very high-tech solutions that we saw also during the pandemic, is that it makes sure that there is no one left behind. So it makes sure that even women who don't have access to technology really know about the initiative and can have, the opportunity to report. Because we saw during the pandemic that the traditional routes for women to report and be informed were not available anymore. The only essential services allowed were pharmacies and supermarkets and some others. So women, had to find a different route. And I really like this initiative because they really tapped into what was a essential resource at the moment. And it's innovative, even though it's not technologically savvy, let's say. I think other ways that we can engage the community, and we saw, for instance, in Albania, is that organizations that work really at the very, very grassroots level, at the local level, they know the community very well, especially in small countries like mine. And because they know the situation, and then they usually know who are the women who are being abused, even if they don't report, they can really use that small community to encourage women, even through phones, through calling the police. We had cases when these organizations, providing services in very remote and local areas, were closely collaborating with police from home. So they were just using their phones and WhatsApp and text messages to, highlight issues, to talk to the police and tell them, where the problems are. And often police would just take their own cars, like personal cars, to go to where women need it. And one other, which is maybe not a very community-oriented initiative, but it really worked well here, is that courts continued working remotely. So in cases when women needed protection orders and for survivors to be taken from their homes or for perpetrators to be taken away, they could get protection orders through the courts because the sessions were being held online. So that was also something that was very positive, and it was all facilitated from organizations. And I cannot stress enough how important civil society organizations, especially those in rural areas, were in really encouraging women to report and get services, because only reporting is not enough. You need to have access to services, because then, trust in institutions, if you don't get the service, will fall, and then reporting, it will sort of backfire if you don't have the whole system working together.
Absolutely. Thank you, Maggie. Osa, what do you think about these community initiatives?
So I agree very much with Maggie on the fact that sometimes low-tech solutions can be very powerful as they are inclusive and they are very much practical, let's say. Around the pharmacy and the code words in pharmacies, this is indeed quite innovative. And of course, we don't know exactly from a health perspective what are the effects, because what we from WHO, the perspectives we take on service delivery for women victims of violence is, of course, that these services, they need to produce the health outcomes that are what the women need. They also need to be safe. And this is, as you were mentioning, Aurélie, that means that the pharmacists, they would need a specific training in how you provide women-centered care from a safe perspective. Then there is also the perspective that Maggie mentioned, that it needs to be connected to a system that actually delivers protection and care. And this system is in some countries quite complex. So we have examples where women need to maybe turn to 5 or 6 different authorities just to get the support that they need in a situation which is very vulnerable. So of course, I think the challenge is to connect the different parts of the system once you have entered it, and this is something I think we can build on from this experience and explore further on how we can better work across. Because I think that this is the only way that we would reach some good results for the women and some good support services for the women who definitely need it. What I also think around what Maggie says is around the NGO-led initiatives, and this is you see it in situations like this now during the pandemic, that NGOs step in where there are gaps in government responses. So this is crucial, and this is also a very important lesson learned we can take back from this.
Awesome. Thank you so much to both of you. As we've been talking about low-tech initiatives, which are very important, but it's also interesting to see what has been done at technological level. So we've seen that different countries have used technology to protect women. So we can see, for example, as Maggie mentioned, in Albania, in Australia, people seeking the protection of restraining orders have previously been required to visit a court registry to apply. Now it can be done online. So this is really helping a lot. We can see apps like UPOL in Italy, for example, that allows victims to alert authorities without making a phone call. So if you're in lockdown, you can actually use this app, UPOL, OUPOL. The app is created by the state police, actually. We can see that in Spain, there is also a WhatsApp helpline for those who cannot make a call. And it was created to provide immediately psychological support to women who are experiencing any physical or psychological violence. So it's called Alert Cops, and it's a citizen security alert system. In France, you have a number which is 114, where without leaving your home, you can even make noise by text message. Deaf and hearing impaired people can also use it. There is the app called Appel in France. And finally, a very strong collective in France is called Nous Toutes, NOUSTOUTES. And they've been doing a lot of free online trainings. And one of them is actually all the day Saturday, this coming Saturday, 21st of November. And it will be posted online, everything you need to know about violence and what to do. And they usually have thousands of people on their calls. When we published the challenge, different people submitted proposals. We had also Tala Hais in Jordan, who talked about grape wine. That can be an app creating a network of people surrounding the person. We have Mufida Abbasi in Aftur in Tunisia talking about temporary shelters. So we see a lot of things coming. Osa, what do you think about these technology solutions? And then I will gather the questions from the audience. Huh?
Well, thank you. Well, I think that we've seen the power of social media through the Me Too movement and so on. So or how we connect differently through media now. So I think it's extremely promising to now see how we connect to find responses to these issues also through technology-based solutions and digital health solutions and so on. In fact, WHO has over the past couple of months done a mapping of these different measures that governments and NGOs have turned or have started to implement in order to improve service delivery, and we will be soon reporting back on this, producing a report on this, and you will hear more about this work in the plenary session where our director Nino Berzulli will present on this work. This mapping has also included the digital health solutions. And as you're saying, there is a huge variety, and it's very impressive to see what has come out from very little time and very short adaptation period. We've seen, as you're saying, the alert systems that connects you to hotlines or support services, but we also see different ways of doing remote case management, which is like a complex way of saying just providing psychological, emotional health support to women through web-based solutions. So this is, I think, the future, and I also think that we need to look into this much more as an integrated part of the health system. I think that we will never. I mean, we will still need face-to-face solutions in this situation because it's a vulnerable situation. But still, this is a huge improvement to what we had before. Thank you.
Indeed. Thank you, Åsa. Maggie, do you want to react to these technological solutions that we have commented?
It's impossible not to, seeing as we are increasingly ruled by technology, which has its upsides and downsides. I think the upsides were mentioned by Åsa, so I don't want to go into that, how important it is, because we saw while working remotely at home, we became dependent on different technological solutions. So of course, we need to look at it and how we can use technology to better, perform our work and better support survivors. But also, I just want to focus a bit on the cautionary tale. Because we focus on technology, we find we do innovation, and we find these high-tech solutions, but then we forget about the inherent inequalities. Because when we talk about women's rights and violence against women, this is the core of it. The inherent inequalities, not just between women and men, but also between women who have access to technology and those who really don't. So maybe coupling together these low-tech and high-tech solutions to not only have the technology, but also make it available to women who don't have the access right now, because they live in rural areas, in remote areas, they belong to different vulnerable groups. So it's important, I mentioned it before, but it's really important to really not leave anyone behind, because then we target one group and then we leave, for our technological solutions, but then we forget that there are other survivors who don't have the means, don't even have the phones, don't know how to use technology. So they would need human-to-human contact. And I think we need to focus also on that, like the basic infrastructure.
Thank you very much, Maggie. So I will look in my chat at the questions of the audience right now. So we have 7 minutes for different questions. The first one is to you, Åsa, about how can we embed the mental and psychological support to women in these times of crisis in the response that we provide?
Sure. I mean, this is something that WHO is very much engaged in, producing guidelines for the health services on how to best approach this issue and how to best provide the relevant care needed. So we have since many years, and I think at least you can say in the last 10 years, been producing a lot of material on this. So the way we work is that we engaged with the different parts of the health system, and we try to make the response integrated in the system through guidelines and through standard operating procedures and so on. But of course, the entry point is the most important, and that is usually primary healthcare or sexual and reproductive healthcare services. And many times a health professional could be the only, let's say, public servant person that a woman meets, or at least the first one a woman meets when you're actually in need of this care. So, and mental health issues mental health consequences of violence is the main sort of disease burden outcome that you have from violence. So I can only say that this should be a priority, and it is, and it's also the way we work and the way what we recommend. And how you do it would definitely be through women-centered care and primary healthcare services. Thank you.
Awesome. Thank you, Åsa. Maggie, we have some last questions. One from Afturd on the collaboration of public services and civil society. I think we will come back to that topic in the coming plenary in 4 minutes. But we're talking as well about what do we do with women who have no access to technology? How can they, yes, have access to care? Because we talk a lot about apps, etc. But these, with the digital divide that happens, what can we do as a low-tech solution?
I think we go back, in this case, we go back to what we discussed initially, the power of communities. What we did when the pandemic hit is that we supported local civil society organizations to provide psychosocial support. But we saw that it wasn't working when women had to drive or had to travel long distances from, I don't know, a village to the main city to get the service. So we supported civil society organizations to hire psychologists, social workers, to be based where the communities are. So in local communities where we saw that there were increased reporting and there were more cases, so that they had a shorter distance to travel. And we also relied on public services, because we placed these psychologists, for instance, in municipalities, in local offices, that women know, that the community knows they are there. So when they were going to receive other services, such as economic assistance during the pandemic, you also had the psychologist sitting there and saying, look, I'm here. If you need me, then, we saw initially it was a bit of a problem, because especially in very small communities, people know each other, so women are a bit reluctant to come forward. But once they started establishing that relationship of trust, that whatever we discuss is private, confidential, and all of that, we saw an increased number of women coming, because word of mouth. When one woman came, she told another friend, that friend told a cousin, and so the power of really, really very small and local communities in small countries. I think it's very, for us, it worked really well, and we are actually extending that. So we are placing more psychologists in smaller municipalities and smaller cities, and we see that it takes a little bit of time, and it takes time especially to develop the trust relationship, because we also have prejudice against people who go to a psychologist to receive support, because we say, well, you must be crazy if you go to a psychologist. So we need to also fight against the prejudice and against the social norms that really look badly upon this kind of support. So that's how word of mouth, really working with rural communities, but also with local leaders. We saw that when especially we had women local leaders, we worked with them because they knew the community, and we trained them so that, they could pass the word to other women. And we saw how powerful that was, because we saw an increased number of women who reported, who sought help, and so they connected to each other. I think it's important to work with local leaders to provide the service where it's needed, not in main centers and in main cities, but even in smaller communities. That, of course, requires a lot of funding, but at the moment, that's what we're doing. And we saw that we had the most result when we did this.
Perfect. Thank you so much, Maggie. I wanted to thank both of you, Maggie and Osa, for your incredible input. I hope you will stay with us for the coming plenary with different speakers following on this very same topic. So now we'll talk about preventing gender-based violence in times of crisis. I invite the audience to stay with us for the next session, and really thank you very much, Osa and Nilan and Maggie. Sorry, also Nilan and Maggie Lubani for your for your input, and welcome to all of you for the plenary. We'll disconnect for a while and come back in a few minutes. See you very soon. Bye bye. We can also see what is.